This is Barry Bailosis, one of the musculoskeletal radiology fellows at Stanford University. 17-year-old with helmet-to-helmet contact with another player, concern for subdural hematoma. In the setting of trauma with concern for subdural hematoma, CT without contrast is the imaging modality of choice. The patient in this case presented with this CT head without contrast. Axial slices through the brain here showing hyperdensity along the right hemisphere of the cerebrum, consistent with subdural hematoma as demonstrated by its crescentic shape. Additionally, there is some linear hyperdensity likely going through the sulci, which may represent a subarachnoid component. This is in contrast to an epidural hematoma, which is usually lentiform in shape. Although not routinely used in the setting of evaluation for subdural hematoma, MRI could be performed if there is concern for more serious injuries such as diffuse axonal injury. The patient in this case presented with this MRI brain T2 fat saturated images showing heterogeneous fluid collection along the right cerebral hemisphere consistent with subdural hematoma. The appearance of subdural hematoma in the brain depends on the age of the blood products. Typically, gradient echo imaging is used to assess for microhemorrhages such as those seen in diffuse axonal injury, and they can be very sensitive, although not depicted on these images. On a different patient and the 69-year-old patient who presents after a fall, the CT head without contrast demonstrates this extraaxial crescentic hyperdense fluid collection overlying the left cerebral convexity consistent with subdural hematoma. As we can see, it does exert mass effect on the underlying brain parenchyma. This is also seen on our coronal imaging here, showing this extraaxial hyperdense fluid collection with mass effect on the underlying brain parenchyma. The midline shift is usually measured in millimeter as a perpendicular distance between a midline structure, usually the septum pellucidum, and a line designated as a midline. In this case, we measure from the anterior falx to the posterior falx and measuring the distance between the septum pellucidum and the designated midline. Brain contusion is a type of intracerebral hemorrhage that typically happens on certain areas of the brain. The typical pattern includes the anterior cranial fossa, such as here, the temporal pole, such as here, and it typically follows a coup counter coup pattern. The brain contusion typically demonstrates hyperdensity centrally with surrounding hypodensity, such as here, consistent with surrounding edema.